Also, welcome to Power Osteopathy and Massage with me, myself, Mark, the osteopath, and
Sarah, massage therapist.
And of course, the legendary
Henry,
our receptionist and clinic mascot. Say hi, Henry. Hi, Henry. Anyway, what we're going to be doing is running through a condition that we see quite a lot of in the summer months in our practice, and it is plantar fasciitis. So we're just going to run through some common things that we see that seem to aggravate it. Sarah's going to show you a little bit about the anatomy of it. Uh-oh. Oh, wow. I mean, poof, Henry, that looks very painful. I don't think my leg can go up.
Sorry, Henry.
Anyway, Sarah's going to run through some of the anatomy with you, obviously where the plantar fascia is, where it attaches, and how it can be aggravated. So over to you, Sarah.
From the heel, or the calcaneus, traveling the plantar fascia up to the toes, there's not much fat around it, and it's a very thick band. But then you also have to remember that it works in conjunction with the calf muscles that attach onto this part of the heel and then travel up the calf or the back of the lower leg. Okay, that's great. What we're going to do, we're going to probably use Sarah's foot. As I've been told, my foot is even bonier than yours, Henry. We're going to show you just a couple of tips and tricks that we found that work and follow us through. Okay, we're very lucky that we have a very colourful foot. This is fantastic. One of the first things that we try and get people out of wearing with plantar fasciitis is the dreaded flip-flops. These are thong-based flip-flops where the little rubber band goes back through the first toe and the second toe here, and you've got the band that goes across here. The reason they're so bad is when you walk, you grip, and you aggravate then the plantar fascia underneath, and basically you end up coming in here an awful lot, and it could all be solved if we just dropped the flip-flops. So one of the first things that we try and encourage patients to do, either have a Birkenstock type of shoe or wear a normal regular lace-up shoe like this. Okay, so what we want is nice support across here where the foot can be fully supported. One of the best treatments that we found that really does help with it is removing all the things that aggravate it. So the thong-based flip-flops really do aggravate it. Another one is walking around barefoot on hard ground at the moment will really aggravate it. Remembering that plantar fascia is right under here and there's next to no fatty covering underneath here. The underside, if you could peel all this back, which luckily we can, it's a very hard, bony area. And one of the things that people often come in here that they've tried is they've got the cricket ball, the lacrosse ball, the golf ball, and they ground their foot on that plantar fascia. And then what they've actually done is they've pushed the plantar fascia into the bones, they've bruised it on this side, and they've also bruised it up against the bones as well. One of the best things that we found that really does work. Okay, we've got some movie magic. Hi, Sarah. Hello.
What we're going to do, we're going to show you how to work through this exercise. So grab a ball. Oh, Sarah, not that size. We're after like a tennis ball. There we go. Okay, get rid of that one. All right, now we're onto the ground. We're going to say that the foot with no shoe on is the affected shoe. So it's going to just simply place her foot on the ball. It's a tennis ball, and simply just roll it fore and aft, forwards and backwards with a mild pressure. We're not trying to grind the foot into the floor, just backwards and forwards 20 to 30 times. We're going to make sure that we're getting the inside of the foot and on the outside with quite mild pressure. The important part is to just try and loosen up the fibers in the foot and encourage blood supply whilst not aggravating them. That's great, Sarah. Thanks very much. Moving on to a stretch now. So we've just got Sarah to elevate her foot up against the wall. Nothing too high, nothing too extreme. She'll already be experiencing a slight stretch on the underside of the plantar fascia, and then all she's going to be trying to do is take her knee towards the wall. That's it, nothing too extreme. And we're just going to hold that stretch 10-15 seconds. That's great. Now I'm just going to point to the back of her leg here. So one of the great things here is we're stretching these calf muscles. We won't go into the full anatomy of them, but if you've got plantar fasciitis, this is linked to one of the biggest causes is tension in these calf muscles. It pulls on the heel bone, the calcaneus, pulling it superiorly, which puts excessive strain on the plantar fascia on the underside. So never neglect your calf muscles on the back here. Okay, stay fit and well, one and all. Remember, health is wealth, and
Hey! Yay! Movement is medicine.
Take care. Bye-bye. Just a couple of little things there that we found that really help our patients whilst recovering from this. The great thing with us is we operate with a team approach with most of the conditions and the patients that we see coming through here. And I think something that we're both agreed on is get a proper diagnosis on this. We've seen it. I mean, I know you've seen it. Yeah. It's a crazy condition where people will come in and say, I've got plantar fasciitis, I've got plantar fasciitis. People have done next to no testing on it, or they're pointing at different parts of the foot that are not even the plantar fascia. So with anyone, always get a proper assessment, proper diagnosis, and you go forward with your team from there.
Health is wealth.
And movement is medicine. Ciao for now.